Before going to see my patient, I'm going to review physician's orders for 2 units of packed red blood cells for Lloyd Bennett, 76-year-old male, and I'm also going to make sure informed consent was signed before the blood is given. So I'm reviewing physician's orders, and the consent is signed by the patient. Okay. Before going to see my patient, I will wash my hands. And then turn it off. Knock, knock, knock. Hello, my name is Sarah. I'm going to be your nurse today. And can I get your name and date of birth? Put it on there. And so the doctor has ordered for you to get blood transfusion. Has he come in and talked to you about it? Okay, so you're aware that, you know, we drew some blood this morning and your hemoglobin levels are low. It's kind of why you were a little bit fatigued this morning with physical therapy. So we're gonna get you some blood, and that should help with your energy level, okay? The lab has called and his first unit of blood is ready. I went down and did my first check with the lab on the blood number, the identification, the expiration date, and the blood type for this patient. I'm gonna get some vitals on you this morning, so I'm gonna get your blood pressure and your pulse, your temperature, those types of things, just so we have a baseline so we can kind of compare once we've given you blood before, okay? Does that sound okay? Okay. Alright, since you haven't gotten blood before, I'm going to give you some ideas of things we're going to be looking out for as a reaction to the blood. So if you're having any problems with breathing, any difficult breathing, if your heart starts to feel like it's starting to race, also let us know. And if your you have pain in like the back part of your back, let us know, because that could be an adverse sign or a reaction to the blood products. And what we will do, if you do have a reaction, we will immediately stop the infusion right at the site of where we're putting the blood in. We're going to disconnect. So we're going to take all that tubing and the blood, and we're going to take it back down to lab. But we're also going to notify the provider, and we're going to get normal saline running in a brand new line to kind of help dilute and get it out. Now I would verify a name and date of birth. So Lloyd Bennett, 11/5/42. Patient identification on his band number 4156.
Yep.
The unit number 0005358.
Yep, that's what I have.
Blood is O negative. Expiration date 3/19/2019.
Yep, that's what I have.
All right, and if I could have you sign. First, I want to make sure that his IV is patent so we don't have any problems with the blood going in. So first I would use my alcohol wipe and scrub the hub for about 30 seconds. And then I'll flush with a 10 ml syringe with normal saline. Make sure there's no problems. Look for signs of infiltration or problems with it going in. It looks good. So I've gotten my blood tubing. The tubing is only good for 4 hours. First, I will make sure that both of the sliding clamps are closed. I will spike my normal saline first. My clamp is closed. Hang that. And I want to fill my filter halfway with normal saline. But first I want to unclamp it, fill the chamber with water. I then want to clamp it, because once I fill or hook this to the blood, I don't want any blood going back up through into the bag. So now I will take the second port and I will put it in the blood. Hang the blood. I would have primed the entire line with normal saline. I will then open up my blood line, get a little bit going. And I will hook up my IV site to my patient's arm, make sure all my clamps are open, but my normal saline one closed. I will come back in, or I will watch as the blood is transfusing to see any immediate signs of any sort of adverse reaction, kind of looking at the skin around, listening to the patient's lungs, see how they're doing, and then I will take another set of vital signs 15 minutes later, and then in 15 minutes I get a full another set of vital signs. Since we don't know how the patient is going to react to the blood transfusion, I am going to start the pump at 60 mils per hour. I will continue to monitor. After my second set of vitals, after that second set, if there is no signs of any problems, I can bump it up to 120 mils per hour. Alright, I will also label the tubing because, like I said, it is only good for 4 hours, and just to make sure somebody else is on shift giving the blood, they'll know when that tubing was used, and if it is expired, they can grab a new set. Okay, the blood has been going for 15 minutes on the patient. This is when I'll do my next set of vitals. His blood pressure was 126/80. His pulse was 76. Respirations were 18. His oxygen saturations were 98% on room air, and his temperature is 97.6. I will do another set of vitals in 15 minutes. Alright, after the second set of vitals, his blood pressure was 130/82. His pulse was 78. Respirations were 18. Oxygen saturations were 99% on room air. Temperature was 97.8. So now that I know that he is not having any sort of adverse reaction to the blood, I am going to increase that rate to get the blood in him. I'll set the pump to 120 mils per hour. I am going to make sure that the bed is in the lowest position. I'm going to make sure his call light is within reach. Make sure that the patient's side rails are up. And then I would wash my hands. After the patient has received the 2 units of packed red bloods, we expect that his H&H levels will be increased from what they were prior to the blood transfusions. We will expect the patient to have a little bit more energy and not experience as much fatigue. And when he rises from the bed, we will expect that he won't be quite as dizzy. I would document everything that was done and then continue to monitor the patient during the blood transfusion.